Welcome to our Vulnerable Children's Board. We have for you this afternoon Brendan Boyle from the Ministry of Social Development, who is the chair of the Vulnerable Children's Board, Peter Hughes, Secretary for Education and the Ministry of Education, and Chuah, Director of Health and the Ministry of Health. So delighted to have for you this afternoon a group of leaders who are leading the work on the Vulnerable Children's Board. It's not the whole board, it's representatives from the board. They'll talk about their work for 15 minutes. Looking forward to hearing from them. Please welcome our Vulnerable Children's Board.
Kia ora tātou, everyone. Thank you. Thank you very much, Paul, and everyone for the warm welcome. Paul opened with a quote. I'm going to do the same. A lot of what we're trying to do and striving to do is about working together, so you'll hear a lot of us talk about collaboration. Someone once described collaboration in government as an unnatural act by non-consenting adults. We're trying to disprove that theory, and we're doing that through a variety of means. I'm just going to talk for a couple of minutes, and I'll pass over to Peter and then to Chuah. And apologies from Andrew Bridgman, the Secretary of Justice, and also Mike Bush, the Police Commissioner, who would have been with us, but they send their apologies. So let's just have a look at the legal environment. The question was asked earlier this morning when the Minister was here about regulatory environment and legal settings. And our conclusion was, while it was no means that it was going to be the answer to everything, it was a very important element in actually getting attention for what we believe that matters. And certainly I can say as a Chief Executive in a government agency that talking about collaboration, talking about national plans, talking about doing things for children is fine, but you actually get an act of Parliament that's passed that gives you statutory accountability, it makes you stand up a bit straight and take notice. So that act, the Vulnerable Children Act, was passed into law last year. And you heard the Minister say, and it's worth repeating that comment, that it was the most significant reform to child protection and the prevention of abuse and neglect in the last 25 years. Because what it does is that it recognises that no one agency can be solely responsible for meeting the varied, the many, the complex needs of at-risk children and young people. And all of you know that better than most. So what's different about the legislation? Shared responsibility across the social services sector in New Zealand, and it provides a platform of accountability and monitoring that we've never seen before in this country. Then we have the board, represented here today. It's the new statutory body designed to support agencies working together. So it's the governance mechanism we like to think of as the glue that helps bring together all the various parts of the system. It requires that we see and respond to the needs of the at-risk children in a more integrated way, easy to say, hard to do, and who's in it apart from us, as I said, the Commissioner of Police, the Secretary of Justice, augmented by the Chief Executive of TPK and the Chief Executive of the Ministry of Business, Innovation and Employment. And they're there because of the housing component, principally. A couple of keys to success that we've identified. One, very straightforward, leadership across the whole system. And secondly, the investment approach that you would have heard mentioned from time to time across the whole social sector. And what is that investment approach? Well, it's a way of making sure that we can target best value for impact on results for children and young people and best value for money out of the public spending that is going into the social sector. It's our role as a board to determine the optimal areas for investment and the best value areas for that expenditure. So it's identifying the who should we be actually working with, understanding their needs, and then applying the what in terms of the resources. So how are we doing that? We're using data and analytics, supplemented by the kind of experience that we've got, the contacts and the input from people right across the whole sector. So we're drawing in information from a range of agencies, using research evidence and striving to find research evidence about what works for the children and the families, not what feels good or what we'd like to do. That enables us to get to a point where we're confident that we can be targeting services where they're going to have the biggest impact. And that's where we're going to have the biggest impact across the whole social sector. It'll help us to address this forward-facing future liability in both human and financial terms, and it's important that we look at them in both ways. So the goal of prevention is therefore central to what we do now and in the future. How we tackle problems early, how we intervene early and with who, how we prevent upstream consequences before those sort of problems become so entrenched in the lives of the children and those families that they're too hard to change. I'd like to invite Peter and pass on to Peter, who's going to talk to you a little bit about the leadership challenges and some of the experiences that are relevant to the education sector.
Kia ora koutou katoa. Thanks very much, Brendan. And just for the record, we are actually all consenting adults in the Vulnerable Children's Board, and it's important that we are. But can I just start by coming back to the theme of leadership? And something like this does not happen without leadership. So, Brendan, if I can just start by acknowledging your leadership of this team. We are a team. Brendan is the leader, and your leadership has made all the difference. So what we're talking about here is really a quite radical shift in approach. So as Brendan said, the new Act signals a different way of understanding the needs of children, young people and their whānau in New Zealand. We've got a national outcomes framework in the legislation. It does acknowledge the whole child. In particular, it acknowledges that we need to understand the child and their family in the community context, who they live with, what their culture is, what their needs are, their health needs, their other needs, how they're doing at school, and what their worries and dreams and aspirations are. And at the heart of the approach is this one simple concept, and that is one child, one plan. Sounds simple, hard to do. And in practice, that basically means that we all need to be joined up around the child and his or her family. So it means we have to integrate and coordinate our assessments and plans. We have to change the old pattern of multiple assessments and multiple plans for kids in this country. And we need to deliver a brand new approach where we've got health education, social development, police, corrections, all knowing their contribution and accountability for the outcomes for the child. So that's the approach. But the approach is also about getting to the nub of the issue. So that means that we have to identify and address the underlying causes and challenges for the children and families that we're working with, and not simply ameliorate or service the symptoms of what's going wrong. So instead of picking up kids from the local shopping mall and returning them straight to school, what we have to do is work with the family and the school to find out why they're not at school in the first place. Instead of just treating kids for scabies, we have to work with their families to deal with the underlying health and housing issues. Instead of waiting for a kid to go into crisis, an at-risk kid to go into crisis, we need to provide that child with upfront support. And instead of handing on problem kids to another provider, we need to find a solution that sticks, real solutions that stick. So making this work in practice, I think there are four things. Firstly, a completely new operating model and approach. In a way, that's the easy bit. Secondly, we've had to completely rethink our thinking around information sharing and privacy. Tricky. Thirdly, we've had to build and sustain a culture of collaboration and teamwork. And fourthly, as I said earlier, we've had to learn to lead and not just manage up and down in our departmental silos. So if I had to pick two things out of that list, the two that I would pick are leadership and teamwork. Those two things, in my experience, really are the engine of making something like this work. So we're learning our way forward. We're very much learning our way forward. We think we're making a difference. We think we're making a difference. It's hard, it's challenging, but it's certainly work worth doing. Cheers.
Tēnā koutou katoa, talofa lava, greetings. I'm just going to close what my two colleagues have just been saying. When I look at what we have to do in terms of actually for the vulnerable children, there are lots of key tasks that's part of almost a symphony of many moving parts. And we need all those parts to be moving if we're going to make a sustained difference on this important agenda. So we start out by one of the important moving parts is about making sure that we actually do have an integrated national plan that's focusing on prevention. Now, we kind of started with one of those, but if you've done any one of those plans, it's one that you actually have to start to write, but always constantly revisit, because 2-3 years down the track, it is very unlikely that you need to actually carry through every single one of those things you set out to do. So I think that that's the important thing, is to actually have a plan that is a living document that we're prepared to keep revisiting and thinking about what needs to change. The second thing, of course, having a plan is one thing, but you actually need to change the policy and regulatory settings and the investment setting as well. Because having a good plan by itself, actually, it actually won't make things happen if policy and regulatory and funding investment strategy actually doesn't align with that. So an example of new policies and guidelines that's been put in place is about the vetting and screening of staff and the things around children protection. The third thing that's really kind of things need to move is about new organizational and business arrangements and things like about accountability around issues around how we organize ourselves, not as my colleague said, as in silos, but actually working as a collective. And we actually have to break the model of having individual silos and have business models and organizations that continue to reinforce the silos. Very challenging, but needs to be done. Last but not least, in terms of the moving parts, is the issues around changing what I would call the enablers. Here we're talking about the workforce reforms, the issues around information sharing, IT, et cetera, et cetera. But also I think there's two things that sits right in the middle of this four moving parts that's kind of fundamental that we keep in mind even when we look at those four moving parts. One of them is definitely about that we actually hear first and foremost about the children and their family. That has got to guide everything that we do around those four moving parts. And the last thing that I would say that sits in the middle is about the ability to make a difference, even if we have the best ideas around the four moving parts, is the agenda of the leadership. The capacity and capability to actually make the transition, moving away from silos towards an integrated plan, working together as a team, requires quite strong leadership at all levels, not just at the board level. Vulnerable children, make a difference for vulnerable children is a complex agenda. And if you have anything to do with working in a complex setting, we all know that there are many causes and effects, and the intervention required needs to be local and needs to be different and varied. One size does not fit all, and when we try those local solutions, we must be prepared to actually accept that some things may not work, and actually when they don't work, that is actually not failure. That is actually part of our learning, and it's really important that the space we create for those new ideas allows for things that don't work, and we shouldn't actually couch those as failures. The many moving parts and factors are because in the lives of vulnerable children and families, there are things going on in their lives that's about social context, the economic factor, the cultural context and the environmental factors all play a part in terms of complexity in their lives. So when we're looking at trying to make a difference, all those things are constantly moving and interacting with each other. So when we're looking at designing something, we need to be aware all those things are constantly moving. So the work has begun, but we've still got quite a long way to go. And working across government together with NGOs and partnering communities is starting to make a difference. But I think we would all agree that there's a long road still ahead of us. And the road is a complex one, and I think that we need to keep having this conversation around, keep making the course corrections, and not thinking that if we've written the plan, that's it. No reira, tēnā koutou, tēnā koutou, tēnā koutou katoa.